Join Stella Academy, Goa's best coaching for IIT, JEE and medical exam preparation. Register today for Stellar Talent Search exam. Admissions are open for repeaters medical batch for NEET 2021.
Cocktails, antibody cocktails.
So the government of India, government of Goa, we have procured antibody cocktail, which is the latest treatment for the COVID scenario. Okay, it's basically a very costly drug, and we have got it for free. And this is like now you can say one of the best treatment available for us. But it's basically two drugs, composition of two drugs. They are antibodies. Okay, casirivimab and imdevimab. Okay, so these two drugs, the criteria is we are giving it for elderly patients who are having co-morbidities like diabetes, hypertension, or cancer patients, okay, who have received treatment, okay, who are basically immuno-compromised and having COVID and coming within the first 5 days of symptoms. Because giving this cocktail beyond 5 or 6, 7 days, the use of the cocktail becomes less. So as soon as they turn positive, we have to give the cocktail. So SDH Chicalim we have started giving the cocktail on 14th, and we have successfully given now for 8 patients, all were elderly and having diabetes and pressure, okay, and all patients post giving the injection are doing well. We have been monitoring them on phone also, and we have been even talking to them, and they have actually very well improved. Some of them who had come with fever and cough are not having fever and cough. Their symptoms also have gone within the next 2 days. So basically we take the patient, we do their pulse BP, we do an ECG, we see if the parameters are normal, and then the drug is given over IV around 40 minutes to 1 hour. Then we keep the patient for observation. Sometimes we keep the patient for an entire day also, but sometimes we admit in the morning and we see up to evening. If everything is okay, we again check all the parameters and we send the patient the same day sometimes. So this is a very wonderful drug which has come, and I'm sure this will be a life changer if we get more and more of these drugs and we can help more and more patients, especially who are immunocompromised.
So is the drug available as of now in the hospital, just in case people arrive here?
We have we have given for 8 patients, so we can give for another few patients, because since it's a very costly drug, it has been just procured by the government. It has been given in all the hospitals, Asilo, Auspicio, and our hospital in Ponda also. So we have got enough samples of short doses, but at least whatever possible we can help, we are doing it for all the patients.